No, we're not surprised. We are disappointed, we're concerned, but we're not surprised because it comes after decades of underinvestment in social care and health. So we're not surprised at all.
Interesting, this note about women from the poorest communities seeing a decline in their health and life expectancy. Why do you think that is?
I think it highlights the wider issue. I think there's sometimes an opinion that older people in the UK have it quite easy. They're sitting on assets, but it shows. This report really highlights that it's a really varied field. So we have we have poorer communities and we have wealthier communities, but generally. Certainly in the north of England, in more deprived areas that have really borne the brunt of underinvestment in social care and health and cuts, we're really starting to kind of reap what we sow in those areas, and as you say, it's affecting women disproportionately. Many of them are caregivers, many of them are in receipt of social care, many of them might be in the sandwich generation where they're looking after elderly parents as well as children and might also need social care themselves.
So government spending cuts, austerity, bearing the brunt of the blame, if you like. Isn't it too easy to blame governments? Isn't this a more complex situation?
It's certainly a complex situation, you're right there. But we know now that social care needs, so long-term care for older people in the UK, it's chronically underinvested, and it has been for nearly 30 years. And it's a political football. It's been kicked into the long grass by various different governments, and we really need the government, we need the Prime Minister, the new Prime Minister, to grasp the nettle and prop up the system that's failing millions of older people and their families, and then also look into a long-term sustainable solution for social care so that older people can get the care that they need.